ResearchKit, a revolutionary breakthrough for mobile medical research. So, what is ResearchKit? ResearchKit is an open-source framework introduced by Apple to help medical researchers to create apps specialized in medical research. Up till now, you may have two questions in mind. Why we need ResearchKit? Is there any predicament of traditional research right now? Problem 1. Hard recruitment of volunteers. To recruit volunteers, a lot of email invitations are sent out every day. Yet, the low response rate limits the scope of research. Obviously, we need more volunteers for more data. Problem 2. Efficiency and cost. Traditional research requires a large amount of medical professionals to conduct face-to-face consultation with volunteers upon their inquiries. They also have to explain all the regulations about the research. Volunteers also need to visit institutions physically to take part in clinical research. The process is time-consuming, expensive, and inefficient. Problem 3. Data accuracy. Some research collect data from volunteers using questionnaires such as the exercise amount, daily intake of food. Yet, the data might be based on their memories, which can be biased. So, how ResearchKit address all these problems? ResearchKit turns iPhone into a powerful medical research device. There are currently 44 million iPhone users in the US. They can all enroll in mobile clinical research by downloading these in App Store, such as Google Success, Empower, Smart Health, and My Heart Counts. ResearchKit apps pull all iOS users together, which dramatically increase the number of volunteers in clinical research. Basically, ResearchKit apps includes 3 typical modules: informed consent, active tasks, survey module. It is compulsory for ResearchKit apps to get consent from volunteers, and the whole process is done within the smartphone user interface through the consent documents displayed. The followings are clearly elaborated, such as the research objective, tasks to complete. All the surveys are also done in the user interface. It is convenient and environmental friendly. While active tasks rely on the sensors embedded in smart device, including GPS, accelerometer, gyroscope, touchscreen, and microphone. By using ResearchKit apps, less medical professionals are required in data collection process. Volunteers also do not have to visit clinics physically, and real-time data are collected from sensors, which improves accuracy. Speaking of its influence, ResearchKit also brought tremendous technological and social impacts. Apart from making use of sensors to gather data, introduction of ResearchKit also stimulates the development of microelectronic technology in medical field, such as the wrist-worn sensor and the smart inhalers. Organizations are dedicated to converge microelectronics into medical research. Huge potential of microelectronics can intensify medical breakthroughs by transforming clinical research into daily technology. Pulling more volunteers for research, ResearchKit apps are also capable of providing customized treatment, such as exclusive active tasks and monthly personalized reports for review and assessment. By making use of the collected data, researchers and governments can together tackle diseases through medical invention or environmental improvement, which helps improving medical health. Unavoidably, ResearchKit also carries some limitations. Those apps are only available on iOS system, but not Android or other system. There are also research found that iOS users are more likely to carry these characteristics. This could raise the problem concerning coverage, diversity, and population bias. ResearchKit apps attract huge amount of volunteers initially during its launch. However, when time goes by, more and more volunteers started dropping off and leads to lower and lower retention rates. Informed consent can hardly ensure that all volunteers are 18 years old and possess the symptoms of the disease. There is no way to verify the eligibility of participants, hence affecting data accuracy. Although data collected are encrypted, it is noticeable that these apps do not comply with HIPAA regulations. The responsibility of protecting the data lies on research institutions, giving rise to privacy issues. To know more, take a look on our reports.